In this video, we'll address commonly asked questions and myths about hair loss, along with tips for managing the physical and emotional effects. Hair loss is one of the most common side effects of blood cancer treatment. Your treatment team will be able to advise you about what hair loss to expect with your particular treatment. Many people living with blood cancer tell us it's one of the side effects they worry about the most. The aim of treatment is to stop rapidly growing cancer cells. Unfortunately, these drugs also damage other healthy cells in your body, including your hair follicles. The main factors that affect hair loss is determined by the type and dose of drugs you are given. Hair loss can occur all over the body, including your head, face, eyebrows, eyelashes, legs, arms, underarms, and pubic region. For some, it can be uncomfortable, but it's not usually painful. It may fall out within days or gradually over time. You can expect your hair to grow back in around 3 to 6 months after your treatment ends, though it can be up to 12 months, particularly after a transplant. Your hair may also be a different colour or texture. This may be temporary for some and permanent for others. Avoid colouring or perming your hair while it's growing back for at least 6 months. This is because when you are recovering from chemo, your hair is more fragile and likely to get damaged. Cooling caps are not recommended. They can be uncomfortable, costly, and difficult to get. And there is no solid evidence that they work. Your hair doesn't fall out immediately when treatment starts. Hair usually falls out gradually, around 2 to 3 weeks following the start of treatment, although it can happen faster with some treatments. Some people experience hair thinning rather than complete hair loss, and it can fall out in patches. People often start to notice these changes on their pillow when they get up in the morning, in the shower, or when brushing hair. Not all blood cancer treatments cause hair loss. It depends on the type and dose of treatment you are having. There are many options for managing hair loss. Your options are dependent on personal preference and comfort. Here are some suggestions. Consider cutting or shaving your hair prior to treatment starting to minimise the discomfort of hair falling out. When you're doing this, it's preferable to use an electric shaver to minimise possible scalp damage. When choosing a wig, it's important to take into consideration the wig material, cost, comfort, and wig care. Beanies and scarves are affordable, easy to wear, and comfortable. Naturally, what you wear will also be season dependent. If you need, there are many online demonstrations on how to wear a scarf. Treat your head and scalp gently. Here are some suggestions. Use a gentle, fragrance-free product. Reduce the amount of product you use. Limit how often you wash your hair. Brush gently with a soft brush or comb. Use a smooth pillowcase. Moisturize your scalp regularly. Make sure you wear a hat outdoors, apply sunscreen, and stay covered up when you can. It's important to protect your eyes by using lubricating eye drops and wearing sunglasses when you're outside. Connect with the Look Good, Feel Better program, who run patient workshops, as well as provide practical resources on cancer-related hair loss and skin care.
Before I was diagnosed, I was quite overweight, so my hair became my security blanket. I'd pull it in front of me, and it became a part of my identity just as much as anything else. I was scared without it, so finding out that I was going to lose it was really scary for me. I decided to take the power back and take control of my situation, and I donated it the day before I started treatment. To this day, that was still one of the best days of my life because it was the turning point for me, taking control back and loving myself from the inside out, realizing that I didn't need my hair to give me self-confidence and that love and that self-esteem that I had in me all along. And I was able to do something positive for someone else. So for that, I'm really grateful. And I get to rock a new hair look now, so I can't complain.
Our hair is often connected with how we feel about ourselves or how we express cultural and religious preferences. Hair loss may bring about different feelings like sadness, anger, or embarrassment. It's okay to have these feelings. Always ask and never assume how someone might feel about hair loss. People of any age, gender, or culture may experience a range of emotions related to hair loss, like grief, loss, or shame. Be prepared and take control by cutting your hair short and choosing your headwear before hair loss occurs. Consider donating your hair to a worthy cause. And it's helpful to know what you're going to say if people ask you uncomfortable questions.